Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms, and I am so glad to be back with y'all this month. And every month we bring to you an important health topic from our friends at UTMB Health. They are our preferred providers for the Bay Area, League City, Galveston, Pasadena, Pearland, all you folks down there. And UTMB Health is who we recommend you go and see. And like I said, we always want to bring you relevant and important health topics. And this month is no different. So we are talking about declining vaccination rates. It's a very serious topic. And I think it's important that you take this information. And to do so, we brought in an expert who is here to talk with us today. We have Dr. Goodman with us. Dr. Goodman is a practitioner out in the Friendswood office of UTMB Health. Dr. Goodman, thanks so much for being here.
Thanks so much for having me.
Absolutely. Would you mind sharing just a little bit more about yourself and your particular interest as it relates to UTMB Health?
Yeah, absolutely. So I'm a pediatrician and I work at the UTMB Pediatric and Adult Primary Care Office in Friendswood. Been here for about 11 years now. I'm a mom myself. I have two kids. You can see them in my picture up here on my wall. One is a middle schooler this year and the other's in elementary school. And they keep me young. Yeah.
I love it. So I just had my twins just got into junior high this year too. So solidarity to the junior high moms out there, because it's a different transition for sure. So thank you for what you do. And I know being a mom and a practitioner, and you're married as well to, you were saying a physician or?
That's right. My husband, Michael, is a public health researcher. So he has a doctorate in public health. He spends the majority of his research working with orphans and vulnerable children in Kenya, but he also has done a lot of research here stateside on a variety of topics, trying to help people live healthier lives.
Okay, so this is a family passion. And this is obviously what you do for a day-to-day career as well. And so we're just going to kind of get right into it, because I think what we've seen over the past couple of years as COVID has made its way into our world, that there has been a decline in vaccination rates. And we're going to get a little bit more into that. But based on our current guidelines that we have, what illnesses are we currently keeping out of our environment because of vaccinations?
I mean, honestly, we are living in a time of miracles right now, where we are able to keep more than 17 serious childhood illnesses at bay with our vaccines. We're able to protect against things like polio, which can leave kids unable to breathe or paralyzed. We can protect against whooping cough and diphtheria, which can make a child's throat swell to the point where they can't breathe. We can protect against things like pneumococcus, which is a really common cause of pneumonias, against things like measles, which is one of the most contagious and one of the most deadly viruses that we know about. And a whole variety of other things. There's hepatitis A, which is a serious virus that can seriously damage a child's liver, that we can get from water sources or produce like spinach and strawberries. So we think we're doing healthy things, feeding our children healthy food. And if they're not protected against these viruses, it could be really serious for them. You know, some of the things that we protect children against now, we may think of as fairly mild. For instance, chickenpox. We have a vaccine for chickenpox now. And I don't know about you, but I got that when I was a kid. And a lot of people think, oh, well, I got through it. What's the big deal? But the reality is that chickenpox was killing about 100 kids a year in the United States and putting a lot more in the hospital with serious lesions in their lungs or even in their brains. And so while serious complications were relatively rare, that's still too many children to die of something that we could potentially prevent. And now with that vaccine, our kids don't have to itch for 2 weeks either, which is fairly nice. And they're less likely to get shingles as adults if they've been vaccinated. So there's a whole wide variety that you can absolutely talk to your pediatrician about if you're wondering what is in the vaccines that we're protecting your child against. But all of them are very serious and potentially deadly diseases. And we're thrilled to be able to protect our children in that way.
I love how you put it, that we're kind of living in an age of miracles where, you know, the things that you and I both went through, the chickenpox parties, right? You know, that I was an 80s baby. And so they would send us to the chickenpox house next door and we get chickenpox, but I wouldn't wish that on my babies because I was miserable. I remember it and I still have physical scars from it. And so, yeah, I mean, how lucky we are. So what are the current guidelines for children and a vaccine schedule right now?
Yeah, so every baby should get a vaccine shortly after birth, and then again at 2 months, 4 months, 6 months, 12 months, 18 months, possibly 2 years, depending on which combination vaccines your provider is using. And then every child should get some other vaccines at 4 years of age, at 11 years of age, and at 16 years of age. So our adolescents are due for vaccines as well to help protect them. And in addition to that, we highly encourage everybody to get a flu vaccine every single year and our COVID series as well.
Yeah, don't let that 11-year vaccine sneak up on you, because for some reason in my head, I thought it was 12 years old. And I took my kids for their 11-year checkup and they're like, I was like, no vaccines. No, you get them at 12. No, it's 11. There was a lot of ice cream after that particular visit, but it went fine and they did fine. So what about adults? What it should be the plan for us if we've had some of these childhood vaccines? Do we need boosters? What does that look like?
Yes, so adults can also get protected from a good variety of diseases, which is so incredible. Every adult should be getting a tetanus booster with a whooping cough component in it once every 10 years, or anytime they've had any kind of serious injury, or with every pregnancy as well, to make sure that their babies are getting that protection, because whooping cough can be very serious for young infants. And then, of course, every adult should be getting flu vaccines every year and their COVID series as well. Adults I have to check my ages on this one because I'm a pediatrician, so I always have to double check myself when I get to the grown-up stuff. But all adults over the age of 50 should be getting a shingles vaccine or talking to their provider about it. Everybody over the age of 65 should also get a pneumonia vaccine. Everybody under the age of 45 should be talking to their doctor about the HPV series. HPV is still one of the leading causes of cancer in young people in the United States. And that is preventable with a vaccine that's very simple and easy to get from your provider. Some people in certain fields or certain jobs or with certain exposures and some people with certain illnesses as well, should also be talking to their doctor about whether they need pneumonia shots early, whether they should be getting the hepatitis B series or the Hib series, or a variety of other vaccines based on their own bodies. So it's really important that you have a doctor that you're seeing regularly for wellness checks so that you can talk about this with your provider and about when you might be due or what vaccines you might want to consider getting as an adult. If you have any young babies in your life, don't forget about that whooping cough vaccine, though we encourage everybody who's going to be around infants under the age of 2 months to be protected themselves so that they don't bring that to the babies.
I love that point so much, because I even remember that when my twins were born, that I got it in the hospital and they administered it to my husband as well, because we had 2 preemies too. And then we made sure that the people around us had that vaccine on board. And I think that is extremely important. We get nervous about whooping cough and RSV and all the breathing things, and then we still have COVID to deal with. And, such a smart point there. And then also shingles, man, you don't want it. I had it and it is so painful. I'm not quite to the age of the recommended, but it was the least fun I've had in a long time. So get the shingles vaccine. I think we've kind of hit on why vaccines are so important. But one thing I wanted to make sure that we got to is we have heard some news reports that they are discovering cases of polio. That polio is returning. What does that mean from a public health standpoint? Can you kind of give us the Reader's Digest version of where they've discovered polio and what that means we need to do here as a community?
Right. So polio has been discovered in the wastewater in New York State in 4 different counties in New York. It's also been discovered in London as well, again in wastewater. What that means is that we have polio passing from person to person in the communities in those areas. And that is something that we haven't seen in the United States since 1979, when we declared polio eradicated, thanks to the really good and effective vaccines that we have. Now, a lot of us may not remember or really know much about polio because for a lot of us, it hasn't really been around during our lifetimes, which is such a blessing. If you have anybody in your life who was around when polio was a big deal, I really encourage you to talk to them about it. My mom was a child when there was a polio outbreak in her hometown, and she remembers just the utter fear that it caused among all the parents, anybody particularly with young children around, because it could often leave children unable to breathe or with limbs that were paralyzed for the rest of their lives. And so parents were afraid to get kids together for parties and afraid to go to swimming pools and things like that. I'm not saying any of that to be fear-mongering here, but just to kind of give you a picture of what it means when there's outbreaks of polio in the community. Now, the people who are at the highest risk are people who have not been vaccinated for polio. And that's primarily where we're seeing the spread in New York, because there are high numbers of people there who have not been vaccinated. But remember that it's not just people who choose not to be vaccinated. Some people are too young to be vaccinated, like our kids who are under 2 months of age, or some are still vulnerable until they've completed their full polio series. So by getting vaccinated ourselves, if we haven't been yet, we can protect the young babies in our lives who might not have a chance to do that yet. Or there are people who either have an immune system that's not working well because of medicines they have to take, or because of diseases that they have, or cancer treatment that they're doing, whose prior protection from vaccines may not be working for them. And so the rest of us who are able to be a wall of protection for those people, if we haven't been vaccinated yet, should really do that now. Because once we see it in one area, it's really easy for it to spread.
And, what do we attribute this declining rate to? I kind of touched on it earlier. Is it because of what we've gone through since COVID? Is this a trend that continues to happen?
So vaccine rates have been declining even since before COVID. With COVID, some of it was just access to care. For a while, some clinics were shut down, or some people didn't want to come in to get their checkups done because they didn't want to be in a clinic where there might be sick people. All the clinics at UTMB have very good protocols in place right now. So if you're putting your child's checkup on hold, you might want to go ahead and give your provider a call and get that set up so they can get caught up if you're not caught up yet. But also there's been a lot of mis and disinformation available and spreading through the internet and through other places. I really encourage you to find and talk to trusted sources like your pediatrician about vaccines if you have questions about them. A lot of what's out there on the internet is out there because somebody wants to sell you a book or make ad money off of you clicking on their blog, and they may not have good, accurate information to share with you based on research that's been done. The research that we have shows that the vaccine schedule that's recommended for kids is very safe and very effective at getting them protected at the times when they're most vulnerable to these diseases. Like I said, I've got 2 kids of my own, and you better believe I read everything there was to read out there about these vaccines before choosing to put them in my own children's body. And looking at all the data, I absolutely 100% would never make any other choice than to follow the recommended schedule that's put out by the CDC to be able to give my kids the protection that they need to have the best chance at living healthy, long lives.
And I think that's one thing we always touch on in these videos is how important that relationship is with your primary care physician or your pediatrician. And to have that trusted provider that you can go to with all your questions too. So come to UTMB, ask the questions. And get, answers from across the board. And, information is a powerful thing, but it needs to come from all the sources, for sure. And so make sure you have a relationship with a pediatrician that you feel comfortable asking questions with. And if you don't, we're going to drop a link below, and you can find one at UTMB Health. Or if you're not in the area, then just find one in general. And then, especially if it's something that you're not, maybe quite caught up with on your vaccine schedule, or you're behind, they can help you get to that point. So we touched on polio being found. What other diseases are we sort of at risk of seeing come back around if we don't stay on our eradication vaccination schedules?
Well, another thing we talked about already was whooping cough. Unlike some of our vaccines, whooping cough is one of those things that we lose our immunity to over time. So if we're not giving those regular boosters every decade as adults, we might lose our immunity to it after a while and be able to share that with other people. We still, in the state of Texas, for the past 10 years, we've had somewhere between 1,000 and 4,000 cases of whooping cough a year. And across the entire United States, we still lose babies every year to whooping cough. About 20 a year will die of it. If we're not on top of those vaccines, then those rates are going to continue to increase over time. And that's really concerning. Even as an adult, you don't want to have whooping cough. It can give you a cough that lasts for 3 months and makes you cough so hard that you break your own ribs. It's very uncomfortable. Measles is another one that's on a lot of our minds as pediatricians. There was that scare back in 2014 when there was an outbreak at Disneyland and about 125 people got sick with measles. Measles is very contagious. If you're not protected yourself, you have about a 9 out of 10 chance of catching it if you're ever in contact with somebody who has measles. It's a very contagious virus. And like I said, it's also fairly deadly for children. About 3 out of every 1,000 kids who catch measles are going to die of it. And that may not sound like very much, but my child's school has about 1,000 kids in it. And if 3 of those kids were to die, that would be a horrible tragedy for our community. And that's anywhere across the board. No child should be dying of a disease that we can prevent. So those are the 2 that are probably highest on my list, but all of these germs are still present in our environment. We still see pneumonias from pneumococcus, but even in my lifetime, I've seen a dramatic drop in the rates of pneumococcal pneumonia since we went from the 7-valent vaccine to the 13-valent, meaning we're protecting against more strains of pneumococcus now than we were. And that's led to dramatic drops in kids going to the hospital with pneumonias. Likewise, with rotavirus vaccines, there was a time when we weren't able to give those during, my practice years. And I remember admitting kids to the hospital all the time with rotavirus because they would just get dehydrated so quickly. They'd show up kind of on the brink of death because the diarrhea is just so sudden and massive. But with the rotavirus vaccine, we still have rotavirus present, but it's not putting kids in the hospital anymore. It's protecting them, making sure that they don't get to the point where they're dehydrated enough to need to be admitted. So lots of these things, even tetanus, is still present in the dirt everywhere. And it's the vaccines that really keep us from having to deal with those really unpleasant illnesses.
So in layman's terms, going back real quick, rotavirus is what?
Rotavirus is a nasty GI bug. It's a virus that gets into your stomach and makes you vomit and have diarrhea. And it's really severe for young babies, particularly. So kids under a year of age will often have diarrhea that's so bad that they can't keep up and keep enough fluids in their body to stay hydrated, which can be really dangerous for them.
Maybe it's just I've been out of the baby game for so long. That was a new term to me.
That's
so I know we we've high level hit on quite a few things today. Obviously, the importance of vaccinations and schedules and all of that. Is there anything that you would like to add to the conversation and talk to our community of parents?
Yeah, well, one of the things that I hear a lot from parents is that they're nervous about doing the vaccines on schedule because it means we're getting 2 or 3 shots at a time, and they would like to spread those out a little bit. And, I'm always willing to work with families on what they feel strongly about, but I really think that it's better and safer for kids when they get the shots on schedule for a few reasons. One, it's coming nowhere close to overwhelming our immune system. The vaccines that we're giving these days have a very small number of proteins in them that are actually stimulating our immune system. When you think about it, every time your baby puts their hand in their mouth or scrapes their knee, they're putting thousands of these immunogens into their body that their immune system, which is very sophisticated, is able to fight off with no problem. And so we have lots of good study data that shows that doing the vaccines on this schedule is really safe. And it's also less stressful on your baby when you do it all at once rather than spreading it out. When you spread it out, that's more times that you have to come into the pediatrician's office and get exposed to whatever is there in the waiting room. But also that's more times that your baby has to go through that stress reaction. They go through the same stress reaction, whether they get 1 shot or 3 shots in a day. But if you spread it out, then that's 3 different days that they have to go through that stressful event. And I actually think that's harder on babies than just doing the shots at the time that they're recommended. Some people have concerns about vaccines and development as well. So if I could just touch on that for a second. If you have any concerns about your child's development at all, please talk with your pediatrician about it so we can make sure that your child is getting everything that they need to thrive. And if you have any concerns that your child has had a reaction to vaccines of any kind, again, please talk with your pediatrician about that. But we have lots and lots of study data spanning decades, covering millions and millions of children that shows that there's no evidence that vaccines are in any way linked to developmental delays, severe developmental reactions, or autism. So again, I really encourage everybody to be in a conversation with a provider that they trust and that whose knowledge and opinions and expertise they can rely on to make the best decisions for their own family.
Such a great point there. Again, reiterating that your relationship with the practitioner is so very important to have someone that you trust. And we are going to drop into the comments again, doctors that you can find. UTMB Health is not just pediatricians, and they have a full comprehensive care team that is ready for you. And that is why we love partnering with them so much, because if Dr. Goodman sees something, she's going to immediately have another team to refer you out to, and they work together seamlessly. Dr. Goodman, thank you so much for joining us today.
Thanks again for having me on.
Yeah, absolutely. And we have covered a lot of information as it regards vaccinations and vaccine schedules, and all of that. We're going to drop some helpful links below so you can see if maybe you and your family may need to get caught up on some vaccinations. We're going to provide some information on how you can get that done. There are people aware and ready to help in that situation. And as always, again, we bring you these videos every single month. There's a lot of them. So we also have a link that we're going to drop below that has everything from cardiology to OBGYN for your teen, OBGYN for you, full gamut. We have touched on it, and we'll drop that in. So if you want to go take a look at any of those topics that might be applicable to you or your family. But we are grateful for our friends and partners at UTMB Health. And until next time, we will see you. Take care. Have a great day.